feeling trapped, anxious, or fearful of stepping outside your comfort zone. If just the thought of leaving your home fills you with dread, you might be dealing with agoraphobia, a condition that goes beyond just social anxiety. Agoraphobia isn't simply a fear of open spaces. It's often a crippling fear of situations where escape seems impossible or help is unavailable. For those facing it, even the idea of running an errand can trigger overwhelming panic. Living with agoraphobia can feel isolating and even shameful, especially when others don't understand why you're afraid to go outside. But it's crucial to remember you're not alone. Studies have shown that nearly 1.7% of adults in the US will experience agoraphobia in their lifetime. And while it's a challenging condition, the good news is that with the right strategies, support, and treatment, reclaiming your life is absolutely possible. What exactly is agoraphobia? Agoraphobia is much more than just a fear of leaving the house. It's a complex anxiety disorder where people feel intense fear in environments that seem impossible to escape. Picture this. You're at the grocery store, surrounded by strangers, and suddenly a wave of dread crashes over you. Your heart races, palms sweat, and you feel the desperate urge to flee. This is the reality for those with agoraphobia. Agoraphobia often involves avoiding places like malls, crowded events, or even open spaces like parks. The core fear is about losing control in situations where help might not reach you quickly. For some, the fear becomes so overwhelming that even stepping out the front door feels like facing a monster. It's not laziness or an excuse. It's a real, paralyzing fear. What's truly heartbreaking is that this disorder can shrink someone's world down to their home. Dr. David Barlow, an expert in anxiety disorders, explains agoraphobia often leads to avoidance, which, while providing immediate relief, only intensifies the long-term anxiety. This vicious cycle can quickly take over a person's life, making it difficult to maintain relationships, jobs, or even basic routines. Agoraphobia and panic disorder often go hand in hand. In fact, many people develop agoraphobia after experiencing frequent panic attacks. Imagine being out at a concert or simply at the supermarket, and suddenly you're hit with a panic attack so intense that it feels like a heart attack. This experience can be so terrifying that the brain starts associating that location with danger, even if it was just a one-time event. This is why agoraphobia can develop as a coping mechanism to prevent further panic attacks. By avoiding those trigger places, people think they're protecting themselves. But in reality, this only strengthens the fear. Research shows that around 30% of those with panic disorder may go on to develop agoraphobia. It becomes a cycle. Fear of the fear itself, leading to avoidance, which reinforces that fear. Agoraphobia doesn't present itself the same way in everyone. Some may find themselves avoiding public places, while others might even struggle to be alone. Here are some common symptoms to watch for. Feeling anxious in crowded or enclosed spaces. Avoiding places that feel unsafe or too far from home. Experiencing panic attacks in specific situations like while driving or standing in line. Needing someone to accompany you when going out. Physical symptoms like chest pain, dizziness, or difficulty breathing in feared situations. These symptoms can be incredibly distressing. It's not just about feeling a little nervous. It's about the debilitating fear that can control your entire life. Imagine being unable to visit your favorite cafe, attend family gatherings, or even take a walk around your neighborhood. Agoraphobia can strip away life's simple joys, leaving those affected feeling trapped and isolated. It's easy to confuse agoraphobia with other anxiety disorders, especially social anxiety disorder or generalized anxiety disorder, GAD. While all three share some symptoms, they have distinct differences. Social anxiety, for example, focuses on fear of judgment or embarrassment in social settings, whereas agoraphobia is about the fear of being unable to escape or find help. Other conditions, like claustrophobia or specific phobias, can also overlap with agoraphobia. Someone with claustrophobia might fear being in tight spaces, while someone with agoraphobia fears open spaces where they feel vulnerable. Interestingly, people with obsessive-compulsive disorder, OCD, may also develop agoraphobic tendencies if they associate certain places with triggering obsessive thoughts. Understanding these nuances is crucial because the treatment approach can differ based on the exact diagnosis. Proper diagnosis ensures that the treatment of agoraphobia targets the root cause, whether it's a fear of panic, social judgment, or something else entirely. What causes agoraphobia? Agoraphobia doesn't just appear out of nowhere. It often develops over time, stemming from a mix of genetic, environmental, and psychological factors. The root of agoraphobia can vary greatly from one person to another, but it typically begins with intense anxiety, often triggered by a traumatic experience. This might be something like a panic attack while driving or an overwhelming sense of dread at a crowded event. The mind starts associating these experiences with danger, leading to avoidance behaviors. From a psychological perspective, the development of agoraphobia is often linked to the fear of fear cycle. Dr. Aaron T. Beck, a pioneer in cognitive therapy, emphasized that people with agoraphobia may become so afraid of having another panic attack that they avoid situations where one might occur. This avoidance gives temporary relief, but ultimately reinforces the fear, making it harder to break free. Childhood experiences can also play a role. Growing up in a family where anxiety was a constant presence can make someone more prone to developing agoraphobia. Additionally, stressful life events like the death of a loved one, major illnesses, or even job loss can trigger the onset of this condition. Our brains can become hyper-alert to potential dangers, interpreting even benign situations as threats. Overcoming agoraphobia is possible, but it requires patience, determination, and the right strategies. It's not about waking up one day and being cured, but rather about taking small, consistent steps toward expanding your comfort zone. The journey can feel daunting, but it's essential to believe in the possibility of change. First, acknowledge your fears. It might sound cliché, but you can't conquer something if you don't face it head on. This means recognizing that avoiding certain places or situations is giving power to your anxiety. Start by reflecting on the situations that trigger your fears and consider why they provoke such strong reactions. Next, challenge the negative thoughts that fuel your anxiety. This is where cognitive behavioral techniques come into play. Ask yourself, what's the worst that could realistically happen? And have I survived this situation before? By reframing these thoughts, you can start to dismantle the hold they have over you. It's also crucial to celebrate the small victories. If you managed to take a short walk around the block or went to the grocery store for the first time in months, that's progress. Rewarding yourself for these achievements can boost your confidence and motivate you to keep going. In addition to these self-help strategies, professional support can make a significant difference. Therapies like exposure therapy, cognitive behavioral therapy, CBT, and even medication can provide relief and help you regain control over your life. Remember, the key is to start small and build up gradually. Agoraphobia didn't develop overnight, so it won't disappear overnight either, but with persistence, you can overcome it. Tip 1. Draw inspiration from agoraphobia support groups. One of the most powerful tools for overcoming agoraphobia is connecting with others who truly understand your struggle. Support groups, whether online or in person, can offer more than just advice. They provide a sense of community, which is essential when you're feeling isolated. These spaces are filled with people who get it. They've been through similar battles, and hearing their stories of progress can be incredibly uplifting. You don't have to face agoraphobia alone. There's comfort in knowing that others are walking the same path and that recovery is possible. Often, people share strategies that have worked for them, whether it's a new coping mechanism or a helpful breathing exercise. Plus, support groups can hold you accountable, giving you that extra nudge to step outside your comfort zone. And don't underestimate the power of simply sharing your own story. Expressing your fears can lighten the emotional load. As Brené Brown, a renowned researcher on vulnerability, once said, "Shame cannot survive being spoken. It cannot survive empathy." Opening up can be the first step in releasing the grip that agoraphobia has on your life. Tip 2. Confront your inner negativity. Agoraphobia often thrives on negative thought patterns. We've all had that inner voice that says, "I can't do this," or "What if something terrible happens?" But here's the thing. Those thoughts are often exaggerated fears, not facts. The challenge is learning how to distinguish between the two. One effective method to break this cycle is cognitive restructuring, a technique used in cognitive behavioral therapy, CBT. This involves identifying your negative thoughts, challenging their validity, and replacing them with more realistic ones. For example, instead of thinking, I'll have a panic attack if I go outside, try reframing it to, I might feel anxious, but I've managed anxiety before and I can do it again. Writing down your thoughts in a journal can also be therapeutic. Sometimes putting your fears on paper makes them look smaller and less intimidating. By confronting these thoughts head on, we start to strip them of their power. It's about taking back control from that negative voice in your head. It's not easy, but with practice, it becomes second nature. Tip 3. Achieve calmness through breath control. When anxiety hits, one of the first things to go haywire is your breathing. You might notice your breaths becoming short and shallow, which only fuels your anxiety further. But the good news? You can control this. Mastering your breath can be one of the most effective ways to calm your mind and body, especially when dealing with agoraphobia. The beauty of breathwork is its simplicity. You don't need any fancy equipment, and you can practice it anytime, anywhere. It's like having a built-in tool to hit the reset button on your nervous system. Paced breathing is a straightforward yet powerful way to manage anxiety, especially in moments when agoraphobia feels overwhelming. The method involves controlling the rhythm of your breath to help calm your nervous system. Start by sitting comfortably with your back straight and your shoulders relaxed. Inhale slowly through your nose for a count of 4. Hold your breath gently for 4 counts, and then exhale slowly through your mouth for a count of 6. This technique shifts your focus away from racing thoughts and back to your breath, which can significantly reduce anxiety. By lengthening your exhale, you stimulate the vagus nerve, which helps to lower your heart rate and instill a sense of calm. The best part? It's something you can practice anywhere, whether you're on the bus, at work, or trying to fall asleep at night. When anxiety strikes, your body shifts into fight or flight mode. The 4-4-8 breathing technique offers a quick reset. Start by inhaling through your nose for 4 seconds, hold your breath for another 4, and then exhale through your mouth for a full 8 seconds. This extended exhale helps release tension in the body, making it a great technique for when you're feeling particularly panicked or overwhelmed. By doubling the length of the exhale, you encourage your body to let go of that built-up anxiety. This method is especially useful if you're dealing with the fear of leaving the house. Before stepping outside, try practicing a few rounds of 4-4-8 breathing. It might not eliminate all your fear, but it can create enough calmness to take that first step. Cyclic sighing is a lesser-known yet highly effective breathing technique that can reduce stress quickly. It mimics the natural sighs our bodies make to reset our stress levels. To try it, take a deep inhale through your nose, pause briefly, then take a second, shorter inhale to fill your lungs completely before exhaling slowly through your mouth. This double inhale helps expand the alveoli, air sacs in your lungs, allowing for a more thorough exhale. The beauty of cyclic sighing is that it's both simple and powerful. It's like giving your body permission to release pent-up tension, making it ideal when you're struggling with agoraphobia. You can practice it right before leaving your house or even in a moment of panic to regain a sense of control. Tip 4. Try out the DARE method. The DARE method, created by Barry McDonough, is an empowering approach to tackle anxiety, including agoraphobia. DARE stands for Diffuse, Allow, Run Toward, and Engage. The concept is simple. Instead of trying to push away anxiety, you lean into it. This counterintuitive approach helps reduce the power anxiety holds over you. For example, if you're terrified of going to a crowded place, the DARE method suggests confronting that fear directly. Instead of avoiding it, acknowledge the anxiety. Yes, I'm scared right now, and challenge yourself to feel it fully without resisting. The goal isn't to eliminate fear, but to change your relationship with it. It's a method rooted in acceptance, which is a key principle in many therapeutic approaches like acceptance and commitment therapy, ACT. When you change your approach to fear, the fear itself changes, McDonough emphasizes. This mindset shift can be life-changing helping you break free from the cycle of avoidance that agoraphobia often causes. Tip 5. Build an agoraphobia fear ladder. Building a fear ladder is a gradual exposure technique that helps you overcome agoraphobia step by step. Imagine it like climbing a ladder where each rung represents a small, manageable challenge. You start with the least anxiety-provoking task and slowly work your way up to the more difficult ones. The beauty of this method is that it allows you to gain confidence gradually. Here's how to create your fear ladder. Start by listing situations that trigger your agoraphobia, ranking them from least to most terrifying. For instance, a first step might be standing by your front door, while the top rung could be going to a crowded shopping mall. Each time you face one of these fears, take it slow. Breathe, pause, and remind yourself that it's okay to feel uncomfortable. You're building resilience one step at a time. Tackling agoraphobia can feel like trying to scale a mountain, but breaking it down into a fear ladder makes the process far less daunting. The idea is simple. Start small and work your way up gradually. By focusing on one step at a time, you can reduce the intensity of your fear responses and build confidence. Let's break down what a sample fear ladder might look like. Step 1. Open your front door and simply stand in the doorway for a few minutes. Breathe in the outside air, notice the sounds, and just stay present. Step 2. Take a step outside. Maybe walk to the end of your driveway or your building's hallway. Don't rush. Take it slow. Step 3. Try a short walk around your block or to a nearby park. Keep your phone or a comfort object with you if it helps. Step 4. Visit a local cafe and stay for just 5 to 10 minutes. Focus on the taste of your coffee or the sound of music playing in the background. Step 5. Head to a less crowded store during off-peak hours. Bring a friend if needed for added support. Step 6. Gradually work your way up to more challenging environments, like attending a social event or visiting a bustling supermarket. Remember, this process isn't about perfection. You might hit roadblocks, and that's okay. What matters is your willingness to try again. Each step you take, no matter how small, is a victory in itself. Tip 6. Self-care strategies for agoraphobia. Self-care isn't just a buzzword. It's a vital part of managing agoraphobia. When you're constantly dealing with anxiety, it can take a toll on your mind and body. That's why carving out time for yourself isn't just a luxury, it's a necessity. Start by focusing on the basics. Are you getting enough sleep? Poor sleep can heighten anxiety and make it harder to face your fears. Create a bedtime routine that relaxes you, like dimming the lights, reading a book, or listening to calming music. Nutrition matters too. Foods rich in omega-3 fatty acids like salmon and walnuts can help regulate mood. Exercise, even something as simple as a daily walk, releases endorphins that can lift your mood. But let's not forget the importance of mental self-care. Meditation and mindfulness practices can ground you, helping you stay in the present moment instead of worrying about the what-ifs. For a quick reset, try guided meditation apps that focus on reducing anxiety. And, most importantly, be kind to yourself. It's easy to beat yourself up when you're struggling with agoraphobia, but self-compassion can go a long way. As Kristen Neff, a leading researcher in self-compassion, puts it, when we're kind to ourselves in times of struggle, we are more able to face our challenges. Treating agoraphobia isn't a one-size-fits-all process. What works wonders for one person might not work as effectively for another. The good news is that there are several effective treatment options available that can help you regain control over your life. One of the most commonly recommended approaches is cognitive behavioral therapy, CBT. This therapy helps you identify and change the negative thought patterns fueling your anxiety. By working with a trained therapist, you can learn to challenge those catastrophic thoughts and gradually face the situations you've been avoiding. Exposure therapy is another option where you slowly and safely expose yourself to the environments that trigger your anxiety. The goal here isn't to overwhelm you, but to desensitize you over time. A therapist might start by having you imagine a feared situation and then progress to real-life exposure. Sometimes therapy alone isn't enough to manage the symptoms of agoraphobia, and that's where medication can come in. Selective serotonin reuptake inhibitors, SSRIs, like fluoxetine, Prozac, and sertraline, Zoloft, are often prescribed as they can help regulate mood and reduce panic symptoms. For more immediate relief, doctors might recommend benzodiazepines such as lorazepam, Ativan, or alprazolam, Xanax. However, these medications can be addictive, so they're usually prescribed for short-term use. It's essential to work closely with your healthcare provider to find a medication plan that suits your needs and to monitor any side effects. Remember, medication isn't a cure-all. It's a tool to help you manage your symptoms so you can focus on other forms of therapy and self-care. The ultimate goal is to equip yourself with coping strategies that will continue to benefit you long after you've reduced or discontinued medication. The journey to overcoming agoraphobia is deeply personal. What matters most is finding a combination of strategies that empower you to reclaim your life, one step at a time. How to support someone with agoraphobia. Supporting a loved one with agoraphobia can be challenging, especially if you've never experienced it yourself. But remember, the most powerful thing you can offer is your understanding and patience. Agoraphobia is not something someone can simply snap out of. It's a deeply ingrained fear, often rooted in past experiences and anxiety cycles that feel impossible to break. One of the most helpful things you can do is listen. Sometimes, just allowing your friend or family member to express their fears without judgment can be incredibly healing. Instead of offering solutions or saying things like, just go outside, you'll be fine, try to validate their feelings. Phrases like, I'm here for you, or I understand this is hard, go a long way in showing that you genuinely care. Encouragement is key, but it's essential to avoid pushing them too hard. Forcing someone with agoraphobia into uncomfortable situations can backfire, increasing their anxiety rather than reducing it. Instead, offer to take small steps with them. For instance, you could say, would you like me to walk with you to the mailbox? Or, how about we just sit on the porch together? This can help them feel less alone in facing their fears. Be patient with setbacks. Recovery isn't linear, and there will be days when it feels like progress has been undone. That's normal. Keep reminding them of their successes, no matter how small they may seem. It's the little victories that build momentum over time. Just being there as a steady presence can mean the world to someone struggling with the fear of leaving their house.